Welcome to the Multidose Podcast, your guide to authenticity, hosted by Multisum Sia. Brought to you by the Multipath. This podcast is more than just insights, it's your dose of authenticity. Join us as experts, celebrities, influencers, and real people share their authentic knowledge like never before. From every episode, you can expect to learn something new and maybe explore a new perspective on your own life. To support our podcast, consider donating to our Patreon and share the love on social media. Every like, follow, comment, share, and penny counts. Find us on all streaming platforms and connect with us on our social media at The Multipath and at Multisum Sia. Your authenticity is just one dose away.
Claire, tell me a little bit about yourself.
Oh, well, yeah, I'm a physiotherapist, but my specialism is pelvic health, so quite a niche specialism of physio. I'm based in London and I do that part-time alongside being a mum. So I've got two kids now who are 6 and 3. So they keep me busy and out of trouble. But yeah, so it's a mixture of being a physio, running my own business, and being a mum.
So, obviously, we had a bit of a discussion before this, didn't we, about your career as a physiotherapist. By background, I'm a physiotherapist. So tell me a little bit, because whilst we're discussing that, you told me that initially pelvic health wasn't your niche. And
Yeah.
obviously, when you've graduated, when I've graduated, it's completely different opportunities, different timings. So tell me a bit about your timing as a physiotherapist and how you got into pelvic health in the first place.
Absolutely. So yeah, I mean, I was chatting about my degree. So I graduated back in 2009 now, and in the way the degree program it was structured, it actually changed the cohort after mine. But for pelvic health, I mean, it was called women's health back then. We didn't even really acknowledge that we treated men. It was very much women focused, and it was like an optional module that you could select, which most of the cohort didn't. So I just didn't have an interest. I didn't really understand pelvic floor or pelvic health. Like, it just wasn't on my radar. I just think in your early 20s it's not. So I didn't do it. And then trying to find a job during that time was a bit of a crisis with the NHS for physio jobs. There were kind of too many of us for the amount of jobs available. I think that's been a perpetuating cycle through the years.
I think that's reversed. And when I graduated, that reversed. There was too many jobs for physiotherapists.
There you
So
go.
so as soon as I came out of uni, jobs were just there. Like if you could find a job and you did the interview well, you got the job. It was as simple
It's
as
so
that.
interesting. Yeah. I think because like how funding has changed as well. So I think it was really oversubscribed in my time. Like it was harder to get into than medicine. And I don't know if that's still the case, but it was really competitive. So it was sort of a matter of like, if you get an interview and you get offered a job, you just take it. And the way, obviously, I mean, you'll know this background, but anyone else who doesn't, when you start in the NHS, which a lot of us do generally, you become a rotational band 5, as we call it. So you're a junior physio and you need more, you get experience as a student, but not in the same way of being kind of an autonomous practitioner and doing your own thing. So when I got this job in London, I went to my first day and I had no idea what my rotation was going to be. And they're like, so you're going to start in women's health. And I was like, oh no, I don't know anything. I'm going to be so embarrassing because I don't know anything. And I just had the most amazing senior team with me who were like, we get it. You don't know anything. We're going to train you. Just like stick with us and all will be fine. In the end, it was amazing. I mean, they're still my friends now and they're still like my mentors now. They're absolutely wonderful women. And interestingly, because I was on a weird contract, I actually ended up doing, because usually you do sort of 4 months, maximum 6 months in each rotation. I ended up doing 8 to 9 months in pelvic health.
Wow, that's a long time.
Yeah, really long time. So basically, by the time I'd nearly done a year in pelvic health before I did any other areas of physio. So I was pretty like, I sort of slightly fallen in love with it. I was like, I love this. This is great. And then I did move and get a different job and do lots of rotations like we all do, neurology, intensive care. And I actually did a long time in intensive care, nearly like 18 months in the end for various different reasons. So, but actually a big part of the story for me is I've become a bit disillusioned. I think we've all done that at different points in our career where I was a bit like, I don't know if I want to do this anymore. It's pretty intense. I don't really know what I want to do. And I decided to take a month, sort of a bit of annual leave, a bit of unpaid leave and go traveling. So I did a couple of weeks in India. I did I worked with a charity. We did some work in like the Delhi slums doing health education work, which was really amazing. And I went off to Australia, saw some friends. So it was a really time for me just to think about what on earth I was doing. And when I was over in India, I ended up working with a lot of women there because that was sort of just the nature of the work I was doing. And a lot of the questions are around pregnancy, postpartum, back pain, pelvic floor symptoms. And I was like, well, you know what? I really did love pelvic health. Maybe that's what I'm meant to do. Now, amazingly, as these things often work out, when I came back from that traveling trip, I approached my old boss and she was like, well, that's funny because we've got a job coming up as like a more senior. Would you be interested? So I interviewed, got that job, went into management sort of a year or so later within the same team. And then sort of gone off then to decide I wanted to have a bit more flexibility. So went into private practice and then have then gone on through having my kids. And then I decided that for flexibility and for our life, actually working for myself and having my own business was going to be the best. So absolutely not. I mean, when I was at uni, I'd done all like the rugby training. I thought I was going to go into like sports physio, MSK, or peds, or, you know, even intensive care. I even at one point thought, oh, maybe I'll go back and do medicine. I really enjoy that. As you
See,
do, because
that is exactly what you're saying. So, do you know, when I was at university, I fluctuated with whether or not I loved physio, whether or not I wanted to do physio, what niche I wanted to be in. I kind of had an idea. I never wanted to be in respiratory. That was number one. Like, no, never would be in respiratory. And I'll come back onto as to why I mentioned that. And then, as we've gone through, I've done MSK, I've done Oldham Football Club, done a football clubs, your normal NHS, MSK physiotherapy work. And when I qualified, obviously I did MSK. I actually went into MSK work, did some NHS work as well. But my last placement was a respiratory placement. And I remember I was dreading it. It was horrible. And it was in the worst timing as well. It was in winter time. So you're naturally just always down anyway. And I loved the placement. Honestly, I loved it. And I was like, you know what? I might actually apply for a job here. But it's quite funny because during the way you just said, where you go through these different phases of whether or not you want to do physio, whether or not actually it's worth it for you to continue. For me, it was exactly the same. But what I liked about what you just said is the fact that you actually took a break and said, you know what, I'm going to take a break. Let me reevaluate things. I think that's a problem with, especially physio as a career. Personally, I could say this is we just don't take a break. We all just carry on because I feel like even in university, you're programmed to think you're a physio, you stay at one job, see it through, do your rotation, see it through, and finish off where maybe after the end, after you've got some experience or enough experience, you can explore potentially. But then it's to be fair, sometimes it's too late to explore. So
it's true.
But I want to come back onto your trip to India. The reason being, my upbringing as a background heritage is from Pakistan, right? And Pakistan obviously and India are closely related, and we've all got similarities. Now, I know in Pakistan, for example, they do not at all consider physiotherapists to be important. How is it in India? How was
That's
your
really
experience in India?
interesting. Yeah, see, I didn't have that perception at all. I don't know if it was sort of the population that I was with. I was on alongside a GP, I think. So they were like really highly respected. And so he kind of, I guess, he was really well respected within the community. And so I was sort of with him and he was all like, she's a specialist in talking about these things. So whether I was massively introduced as a physiotherapist, I don't really remember, but I remember the women being so warm and just so grateful that there was even the opportunity to explore these sort of topics and talk about them. Because I think so much of it is still taboo. And I think women do often just crack on and struggle on or have multiple children and not realize that actually their health and well-being in their pelvic health or back or whatever is actually something that can be supported. So yeah, interesting. I didn't have that experience or perception at all.
It's because even when my parents have told our family members, for example, oh, like he's graduated as a physiotherapist, he's got his own clinic. It was always like, so what's a physiotherapist? And do you know what they call those in Pakistan? And this is why I've asked you, because I didn't actually know you went down to India. Is they call them masseuses. They think we're masseuses. We think we're basically massagists. So I was like, so do you know when you've said you've gone to India and you've done this experience, you've spoken to these women? I'm really surprised because I previously worked with a colleague. It's one of my shortest jobs I've had. It was more like a locum role that I did. And I think he was from India and he worked in India for quite a while sometime. I said to him that I was like, did you not feel, like you said, the taboos, the stereotypes? Did people not look down at you or degrade you? He was like, no, he was like, I was well respected. But I was like, on the other hand, if you went to Pakistan just up the border, you wouldn't be respected, you wouldn't be known who you are, you'd be considered as a masseuse. So that's quite a fine point that you made, that in India is quite different.
But I also think I was going to say it's an interesting topic because I think, you can observe within physiotherapy, it's a very white profession generally. Well, definitely in my cohort, like 10. I mean, we were discussing before this. I graduated 10 years, so I'm starting to feel my age a bit. But in my cohort, it was pretty much white British men and women. And I think in London, you can pretty much see that across the board as well.
Mm-hmm.
So for me, it does not reflect the population of the area. And interestingly, when Black Lives Matters happened and there was a lot more awareness of diversity, it really took me back. And I was like, crikey, my profession is so undiverse. Now, when I started talking to some of my friends who are from, different ethnic backgrounds, they're like, the interesting thing is it's our families would never have encouraged us into physiotherapy some degree because it's not respected in the same way. And I was like, oh, that's interesting. So I wondered if it's like you don't see yourself, anyone like you doing that profession. Therefore, do you know what I mean? Because sometimes it takes you knowing someone doing it for you to then think, oh, I'm a bit like them, I could do that. But I don't know what your experience was like with that.
Yeah, it was because something my previous clinical director said to me, she went, you don't know what you don't know. And this was actually in relation to, studying or revising. And this is when I was newly qualified. And I was like, I'm revising so hard, but I still can't get it. And she was like, well, you don't know what you don't know. It's simple as that. But it's the same thing to how you said, you don't see, my culture, for example, or my background wouldn't see a representation of a physiotherapist being a brown male person who's a physiotherapist because there's multiple reasons, and I could tell you personally, and I've experienced this even now. Like just today, for example, I was booking some of my clients in, and majority of them went, we want female therapists. And the reason being, there's three main factors at play. Being from an Asian background, I don't think my parents' generation, for example, they don't know who a physiotherapist or what a physiotherapist. So that's not ingrained in you either. So you actually don't know what a physiotherapist. Do you know what you know? I'll tell you the three jobs you'll know. You'll know to be a lawyer, you'll know to be a doctor, or you'll know how to be self-employed. That's the three jobs Asians will know because that's just something that you're brought up with. You be a doctor, you be a lawyer, or even engineers and things. Like they'll know those mainstream jobs. They're well respected. That's why. Similarly, the other reason being is by background. And I know this from personal experiences where it's almost frowned upon constantly interacting with the opposite gender, and especially hands-on with opposite genders. So it's kind of frowned on. Religiously, it's not permitted, but there are exceptions. Obviously, in healthcare professionals, there are exceptions where you have to get hands on. But even if it's by choice, for example, you have a choice of what clients you want to deal with. Technically, you shouldn't be seeing the opposite gender religiously. So that's another thing as to what plays. I think the third main reason being is overall that diversity of going to physiotherapy as a profession when all that your parents know and is the mainstream jobs, what your culture and your religion teaches you, and there's nobody actually there to tell you exactly what physio is. When I applied for physio, I'll be honest, when I applied for physio, it was a backup purely because I heard someone mention it at high school. So I heard one of my teachers say, "Oh, why do you not go down to physiotherapy route?" And I thought, "Oh, right, okay, cool, whatever." And I thought, "Do you know what, I'll keep it as backup, whatever." And medicine was actually my initial choice. So,
Interesting.
medicine was my initial choice. Went down the background of. Then I thought, "Do you know what, I want to go into physiotherapy. I'm not really good with blood. I'm not that type of. I get grossed out quite easily, to be honest. So I could have went to medicine. I just chose to do physiotherapy. And I remember, and I think this is a fourth main factor. Do you know, because our parents, our generation, and our upbringing sometimes didn't they didn't like the fact that their child was going down to physiotherapy where they again thought they were masseuses, they're massagists, they don't know anything, they just get handled. All you do is just massage people, and not being insulting to massagists or masseuse and anything like that, but it's just the stigma my parents or my family would have, or the older generations would have, that are uneducated in these areas. So I think that's why, even from my personal experiences, I still experience this until today, where I'm having to convince clients to trust me, as in, look, don't worry, I'm not going to. But even I know, and I've watched and I've observed in my previous roles, even when I was junior, when I qualified as a specialist band 6, when I was observed colleagues, white males, my white male colleagues, for example, they would have a much easier time than I would with clients. And I noticed this right from the get-go when I graduated. They would always have an easier time because when they would ask questions, women would trust them straight away. When I asked a question, it was always like, please don't speak to me. And so where there might be 3 barriers for a normal physiotherapist, there was like 10 for me. So
Interesting.
that's why when you brought this conversation of culture to this, I was like, this has to be shown, has to be heard, because I don't think anyone, like you said, anyone will really openly speak about, let's speak about colors, let's speak about religion, let's really speak about culture. But I think the conversation, university, we had this discussion before, didn't we? Universities, don't touch on important topics such as
Yes.
pelvic health, which I don't think my university really emphasize as much as they should have. They should have
Yes.
emphasized that way more than they did. But with culture, religion, I think we touched upon it. Do you know how you go through your main foundations? Oh, but you have to be good at communicating. You have to be respectful to other
Yes.
people's beliefs. It was never the fact that, by the way, when you go in, you might experience some racism. Just to let you know, you might experience some
Interesting.
stigmas. So yeah, that's why
Yes.
I think it's just such a fundamental point to acknowledge and at least throw in there for the audience, to be fair, who even are considering or maybe go to physiotherapists or
Yes.
even want to study physiotherapy, to know that these things are realistic in physiotherapy as well. It's just a
Yeah.
fact.
It's everywhere. Yeah.
Something else I want to move on. You've got your own clinic. So that is
Yes.
something I want to touch on because you've worked in the NHS, you've done your experience in the NHS, you work privately, have you?
Yes, I worked within sort of for another company, and
Yep.
now, I mean, I don't have my own building at the minute. That's in the long-term plan, but I run my own clinics in
Nice.
clinic space. So I work
Nice.
alongside private GPs, and I also work along consultants. So I sort of work in two different settings, which is lovely. Lovely variety, to keep things interesting, but also
Yeah.
have different colleagues that you're alongside. Because what I actually really missed when I moved out of the NHS was that kind of multidisciplinary working with
Yeah.
other doctors. Because when you end up in a physio clinic where it's just all physios, it's wonderful and you're all really similar and you generally all like the same thing. But I sort of really missed that sort of chat with a doctor who was just in the next door room, or that sort of clinical, I guess, reasoning that you get to do when you
Yeah.
just pop in and say, look, can I run this patient past you? And yeah, so I really, really like that about it. And yeah, it gives me flexibility.
So do you know something I want to ask about the way you run your clinics and how you worked out? So you've kind of touched upon my point here. So I wanted you to compare the NHS to your clinical work privately, just because I know a few questions I've been asked by students or during my audiences when I've done some engagements was, how do you compare NHS to private work? And
So I think some of the big things I've noticed about leaving the NHS, there was two things. I think from a clinical practice point of view, I just love now that there is no barriers to my time, that I can see people as many times as I need to. I can really make individualized care. And I think that was something that I became really frustrated with, is that I was just feeling like, I know I need to do X, Y, and Z, but I can't because I can actually only see you again in 6 weeks. And actually, therefore, I'm not going to be as effective, or I feel like I'm not going to help you as much. And so I love that about what I get to do now. The hard thing I think I also feel is I don't see quite as much diversity within the population. So the beauty of the NHS, and I worked in a really mixed area of London where incredible privilege alongside, people who really didn't have much. And so my days would be filled with people from all walks of life. Now, ultimately, when you move into private practice, there is privilege that comes with it. So I guess I don't have quite the same diversity, and I do miss that to some extent. I think it's really important to be with all people in society. So there's definitely that slight change as well. I think the interesting thing about being a physio in the NHS, which I think is different to, say, the medical program, is that you get to a certain point and you have to do management. And so, like within medicine, you go up and you just keep getting more specialist in your thing. You don't suddenly become a manager until probably you're a consultant, and then you do some managerial stuff, but you don't actually become like an admin person.
yeah.
Whereas obviously from our perspective, you do your 5, you do your 6, you're more senior, and by 7, you're like running the team and you're like doing lots of like admin and management for the team. And I think the hardest thing is you're not trained for it. It's just assumed that by the time you get there, you're going to know what you're doing. And 2, it's really different skills, but also really takes away from your ability to do your day job, to be honest with you. I started to find that I was so consumed by managing the team, by targets and this, that, and the other, that the kind of time in my patients was really pulled away from. And also, I think what happens is, because of the nature of it, it's sort of like a triangle. You have more people down the bottom in the juniors and you have less seniors. Those seniors end up having a lot more of the complex cases. So then your days become, I think, much more intense because there's a lot more complexity with every single patient that you're seeing. Whereas now within clinic, there might be more complex presentations, but then I might have someone who, I don't like the word simple, but it's a more simple presentation. And so I think what I find now is that there is just a lot more diversity within my day. I don't find that quite so intense. I'm also not thinking about 3 other team members and how they're going to need support. And though I loved that for that stage of my life, I guess where this neatly moves on to is becoming a mother is a very different experience. And I come home and there are two little people who need me in a very important way. And I can't be burnt out and I can't be giving, you know, everyone else my energy and attention when they really are my priority. So I guess that was I remember saying to my now husband when we were dating, I was like, I don't think I could do the job I'm doing in the NHS when I've got children, because actually I'm finding it so emotionally taxing that I don't know how I would manage that with then emotionally giving my children what they need. So I guess that did come to the slight. COVID was a real tipping point, and I think it was for a lot of people. So what was interesting for me is I went on maternity leave just before 2020. My son was born in January, so he's my youngest, and then obviously COVID hit 8 weeks later. So I went into COVID with a toddler and a newborn, and my husband is a doctor, so actually he was out the house. It was pretty hectic, and it was really a time where, one, I guess I had to really revisit, you know, what's life going to look like now post pandemic when I come back from maternity leave. And obviously 2021 was still pretty bad. And I got to the point where I was like, the way childcare was, the way that my husband's job was still at that time, I just was like, I need flexibility. And actually, for us to juggle the two kids and school starting and all these sort of things, I just went, I actually can't be fixed by someone else's terms and conditions anymore, because that doesn't work for us as a family. It wasn't like I was unhappy in that job. It just got to a point where this is not sustainable. And actually, during the pandemic, as a sort of coping strategy, I turned to social media. And as I guess a lot of people do. That's really when I started sharing stuff, because one, I was very acutely aware that women weren't receiving care that they needed, and actually giving bite-sized pelvic health support at a very scary and lonely time for pregnant women was being really beneficial. But also, I think as a massive extrovert and someone who's used to being with people all the time and then being stuck at home with two children, actually for me to have that connection through social media was actually a real lifesaver for me. And that moment in time has really pivoted my career, because actually, I guess, access to social media, you know, a wider audience, it's really meant that my career has taken a path that I never imagined, never imagined. So I guess that's how motherhood fits in, and kind of, I guess, how I've gone from NHS through.
Yeah. So there's something, there's actually a few points that you mentioned there, and I feel like we'll be speaking forever if I picked up on all of them. But I want to go through your experience with social media, because that was a nice point you touched on. Your experience with social media. So as a physiotherapist, I know there's two main issues. One, that either people just don't want to pay attention, or you've read the other end of the spectrum, where people have been glorified, but they're not the most educational people that you should be following. To put it nicely. How
very
have you
diplomatic.
found? Yeah, had to be diplomatic about that, because I follow a few of them. And so how have you found your experience with social media as a physiotherapist? Because I know I tried this personally, and I thought, you know what, I'll be honest, I was failing it as a physiotherapist. I thought I'm not doing well as a physiotherapist, putting content up. But then obviously my other life, coaching work and public speaking, has done better. So for you, how did you find your way to, how do I say this, to break into the social media world as a physiotherapist?
Yeah. To be honest with you, I think I went in there as a very sort of, I'm doing this with you. So I think that's where my situation with the pandemic and having a young baby, and I guess doing my own recovery, was more sort of, I guess, partly sharing my story, as well as bringing it on. And I think that's a huge thing, that people love to be able to identify with you in some way. I do think that women's health has just exploded in the last sort of 5 years as well. So I think I was probably just at the beginning of that wave where women were like, enough, I want support, I need support. I've definitely felt the fear, in the sense of like, what I'm putting out there, are people going to scrutinize me? You know, I always do my best to be up to date with the most latest research. It's constantly evolving, it's constantly changing. And I think I don't think I've ever put myself out there to be like, I'm literally the best physio in the land. I think the gift I think I have got to some extent, and this isn't, I've thought this, I think people have said that, is translating information so it's approachable. And I think that's what physiotherapy can so be at times. And we can all get a bit cerebral and be like, oh, this research said this and this. And actually, what we have to remember behind all of this is a person with feelings and emotions. And when it comes to pelvic health, a lot of this stuff is very emotive. It's very difficult to talk about. And I think just providing a platform that shone a light on things like prolapse and incontinence, women were suddenly like, oh, there's someone out there who isn't 65, talking about these things, you know.
Yep.
And she is a young mum too, and she's doing it and she's living it and she's getting back to exercise and she's sharing some of the challenges. And I think that's really where I connected. And I think people love story, don't they? They love to understand that you're not, I'm not here dictating you what you should do. I'm here saying, this is my journey, this is what we recommend, join me. And I think that is the difference. I think what I think from a health perspective, like, engagement can be really mixed. And I think I've got to a point with social media where it doesn't dictate my worth. I think that's really important. You know, you can put a reel up and think, oh, or put a post up and like, oh, it hasn't got many likes. That's okay. You know, I think what I've really always come back to is, even if that has helped 5 people go to their GP and say, I'd like some support, that was worth it. And I know recently, like, I put something up about a symptom called vaginismus, where the pelvic floor tightens with pain and with intercourse, on the result of Megan Trainor from the US sharing about this very publicly. And suddenly, out of the woodwork, I've had loads of emails with women being like, oh my gosh, thanks for talking about this. I think I've got this. Can I come and see you? Now, even if that's only helped 5 to 10 women, that was worth it. So I think with anything with social media, you've got to come back to your why. And actually, if your why is consistent and it's right for you, and it's not, you're not defined by your profile, by your number, by your likes, then you will do well. And you will, but not in a kind of numbers point of view, but you will succeed as well. What I always say to people when they ask me is like, why are you doing it? Is it because you enjoy it? Is it because you need clients? And as long as you keep that in the understanding of when you're doing it, it doesn't matter. If your clinics are busy, but why do you need 1,000 likes? You know, if you got 1,000 likes, then maybe your clinic would be too busy and you'll then be stressed. So I was like, you've got to keep that balance and perspective when you're doing it. But I think that's been my experience.
Yeah, and you know what, I like the idea that you said, it's someone posting something that's not 65, that isn't, you know, the stereotypical stigma. I'm going to come back to this stereotypical stigma, because physiotherapists, I feel like people only see physiotherapy or physiotherapists when they feel like they're at a certain age, or they've hit this certain boundary of their life where I think, actually, I need to be more safe now. And I actually I had a client today who said to me, do you know what, like, I wouldn't come often privately initially because it seemed like a luxury to me. Physiotherapy is a luxury. And I was like, and this is not the first client that said this to me. So I was like, how can you say physiotherapy is a luxury? I was like, it should be like the way you go to a GP. I was like, if you have an issue, you go to a physiotherapist, or you'll go to a GP for if you had a cold or something. Why would you not go to a physiotherapist if you have an issue with, do you know, if you want just a consultation, have one with a physiotherapist. But I've heard this a few times now, and I like the idea of what you said. Don't paint everyone with the same brush, and not everyone comes with the same presentations at the same age. And we know this, for example, we have the red flags, the yellow flags, the black flags. We've got every single flag on the planet right now. But all that, I think, is important, because it just demonstrates that, look, if someone under 20 is coming with low back pain, it's a red flag. That's not normal. Like, that's not something you should be looking for, but it happens. That's why they're there.
Yeah,
And
absolutely.
I think that's something that needs to be, you know, like I said, reflected on. It's something that needs to be shared. And I said to you, I think, I don't know if I actually said it because we were recording, but I obviously looked at your social media profiles prior, and this is why I did want to get you on, because you're the ideal woman physiotherapist that's making a difference on social media, making a difference in her career, but it has the reality of difference between social media and real life, because I said this before, whatever people share on social media isn't necessarily what they're sharing in real life. I've heard about clinicians and just people and other professions where they're sharing on social media, people have gone to them and the experience is completely different. And you just think there should be a reflection, you should be parallel to what you're doing online and in real life. So especially in our profession, it's like I understand when some people do it, you know, for entertainment, they're doing stuff for entertainment, of course, that's fine. But our profession is where you're sharing important and sometimes life-changing information. And in your case, where you said, even if, and I think this is something I always try to remember, because sometimes I think I personally become consumed with this. Well, I didn't get that many likes. So, do you know what? I've worked really, really hard to make this video. Actually, I know what I'm talking about. I've got the qualification, I've got experience, but I'm not doing as well as, you know, John Doe down there. Like, he's got like 1 million views, and he actually had no qualifications. He's just good looking, or he's got a big following, and I fall into that trap. But I do you know exactly what you've said, where even if it helped one person, even one person liked that video, or even one person watched it, didn't like it, didn't do anything with it, but knew, they went away and thought, do you know what, I actually pulled my hamstring. I need to know how to do. Oh, I learned the stretch and it worked. And that, I think, makes a massive difference for me personally as well. So it's so nice to see someone else, different location to me, different experience to me, different niche to my own profession, and having the same ambition, same purpose. And that's what it's about, isn't it, as physiotherapists? It's about sharing those ideas.
Absolutely.
So the next thing I want to come on to, actually, whilst we're talking about all of this, so you've mentioned your background, you mentioned your experiences, you mentioned your passion and your drive and your ambition, the main thing, your purpose in all of this, and your social medias. You have a project which is coming up. I'm not going to say anything about it. You say what you need to about this, because I'm excited for this.
So I've written a book, which just still feels like such an insane sentence to even say out loud, and was definitely not on my career plan. Like, if you'd asked me 10 years ago, what do you want to do in your career? Writing a book? Not one of them. And it's been a really interesting journey. And I think social media does open up a world to you. You know, I never started social media with that being my plan, but obviously there's been lots of things that are weaved through from it. So I initially got approached by, a publishing house, and they're like, I think you should write a book. And I was like, no, like, I'm a physiotherapist, like, I don't see myself as an author. I like being in the clinic room. I don't know how I'd put that in a book. And they're like, okay. And then a few weeks later, I know this person, she was like, I mean, I just think you could think about it, let's have a meeting, let's have a conversation. So I was like, okay, let's have a conversation. And then I was a bit like, and I spoke to my husband, he's just like, I think you just need to pursue this, like, this has come up, pursue it, see what happens. Like, you don't have to say yes at any point, you just need to see where the journey takes you. And then, interesting in that, I then got approached by a literary agent, and it just sort of snowballed to the point where I got a book deal, and then I wrote a book. So I started like last September, and it's going to print in a few weeks, and it will be out in September. And the focus behind it is pelvic health based, but it's very much, and it is a female based book. There needs to be a male one, but that's a whole nother book in itself. But the focus is very much on taking women, but I do think it would be helpful for any healthcare professional that works with women, whether you're a PT, a physio, a GP, or anything. I think just understanding the topics that I discuss, and probably a lot of people will resonate or know someone. It goes from childhood through life up to menopause and beyond. So discussing some of the key influential factors, because I think pelvic health, when we talk about, we often think like, oh, pregnancy, postnatal as a definitive time when pelvic health is super relevant. And that is true. There's a reason that there is that conversation. But often when I work with women in clinic, and I'm sure you see this within your profession, you start talking back and they're like, yeah, well, I did have this, and I did do my ankle, actually. I did sprain my ankle when I was like 13 and da-da-da-da-da. And you're suddenly being like, yeah, what you're feeling now is the product of a journey that's got you to this day. And I wanted to start having that conversation, because a lot of women I work with are postnatal or in their 30s, 40s. And actually, like, well, actually, I've always had this problem. I've always done this and I've always done that. And that's a significant part of their understanding and journey. I'm also really passionate about the next generation and things being different. And I think now I am a parent, this kind of opportunity to change things for our children, to start having conversations around pelvic health, around just their genitals in general, their bladder and bowel habits, and it not being shameful and not being embarrassing. But I think the only way that we can do that is if we understand our bodies better, so we can impart that knowledge. So the book's called Strong Foundations, because for me, it's very much looking at your own, foundations, what you're sort of building your health on, but also these foundations that we put in for the next generation. So that's the kind of, I guess, the synopsis of the book.
You mentioned obviously it's women based, which is completely obviously fine, but I think personally, I think that's something I would still explore, because obviously as a clinician you work with all these different genders, and but from your perspective, what kind of age ranges is it working from, or is it guided towards? Because I know there'll be a few young'uns here and there'll be a few older. What kind of age range would you be looking at to target?
I really wanted to pitch it from I guess like 20s well up into 60s, because I talk about the kind of pre-pregnancy days and stuff that impacts us, and it's very much this preventative vision. So actually, yes, it's great we talk about it when we get to perinatal, but why not try and be preventive? So I think if anyone's listening that thinks like, okay, I'm not there yet, obviously I'd love to get pregnant maybe one day, like, it would still be really helpful for you to read it in the context of what might be ahead. Equally, I've tried to be open within the book to be like, wherever you are on your journey, even if you've moved through perinatal, but you've got a niece or a granddaughter or a daughter who's in that stage, screenshot her these pictures and send them to her. Like, for me, the vision is very much that we are stronger together, and that one person tells one person. We build a community, we build a change of narrative around this. That's what I want it to be. And I really hope that, I mean, I go to some lovely toddler groups now with my kids, and there's like grandmas there, and they've asked me about my book, and they're like, oh, I want to read it too. And actually, they're like they're postmenopausal, but so much of the foundation of it is still very relevant. And what if they can still make changes? And we know from research you can still make changes. And an important thing, which I think really links into MSK, and I guess when we've done elderly work, which we've all done in our time generally, is this association with falls. Now, there's a high association with falls, with incontinence. So actually then, if we can actually support women 60s, 70s, 80s to get their bladder, pelvic health better, are we then going to actually be able to reduce falls, the link with hip fractures, then that with morbidity and mortality is huge, and actually the real message for me is like, we are one body and we are one health. And though in medicine we love to be like, you're this problem, you're that problem, you're that problem, actually when we deal with pelvic health, we improve our ability to probably exercise and do resistance and weight training, which will help our bone health and our heart health as we age. It will also help our bone density, so that we're then maybe not going to have so many fractures. And my grandma died after having a second hip fracture, and actually if she'd had that conversation earlier on, maybe things would have been different. So there's, for me, it's the drive behind the book is, let's change this narrative, let's challenge the norm, and let's make things different for the whole of the generations that are still here on the earth. We've all got something we can learn about this.
Yeah, and do you know what? Like you said previously, it's that domino effect where one thing happened, like you might have sprained an ankle 10 years ago, and right now, because you've done no rehab in between, it all of it has actually just added up now. And obviously people, and I always say to my clients, I don't expect you to know this. I don't expect you to even consider that something you've done 10, 15, 20 years ago could actually affect you now. And I swear, someone said, I listened to actually in a podcast, and someone said, something that you've done 10 years ago, for example, or 15 years ago, you put it in a timeline and it's messed up here, but you continue to go, it's still messed up there. That still needs to be untangled. And then it's going to ripple all the way down until you get back to where you are now. So you've got a long chain to fix things. And that's exactly what it sounds like your book's about. And do you know how you said it links into MSK, and do you know, it will link into respiratory, it'll link into neurology, it will link into every aspect of physiotherapy. And let's just take the conversation away from physiotherapy altogether. It'll link into just general health, or general lifestyle, quality of life, your
mental health.
Mental health, people's gregarious natures, their sociability. Everything becomes influenced by, your one. I think I feel like I hit the nail on the head with your purpose here, is just spread the knowledge so that it affects as many people as possible. And I feel like just your whole purpose of sharing knowledge, sharing your expertise, but not in the sense that you're becoming a teacher to a student, physiotherapist to a client, or a parent to a child. It's more as in, by the way, guys, I'm one of you. I'm a female. I'm a mother. I'm a physiotherapist. I'm a child. I'm a niece. You're everything. You're the whole relationship to all these different people in all these different ways, and the community that you're building. And I think that's, in part, it's admirable, and the other part, it's actually quite inspiring. And I think a lot of people, especially, if all the younger audience have someone to look up to, it should be people that have those same natures or the same wishes or the same desires as you do. But just to wrap this up a little bit,
the stage is set, the spotlight is on. This is Doses of Authenticity, where the real stories unfold, every answer reveals a new layer, and the true self shines. Let the questioning begin.
What is your number one life philosophy?
I think what is meant for you will not pass you by.
How do you want to be remembered?
I think for being loving and caring and just meeting people where they're at. That's what I want to do, and creating space without judgment, I think, really.
One change you would make to society as it is now?
That we would all get therapy. I think like all of us could do with some talking therapy. Like, you don't have to have massive trauma or issues, but just space created, whether you call it therapy or not, just in a space to explore emotions and feelings more easily, and on a weekly basis.
The best advice you have been given?
I think probably like trust your gut. because I've generally done that through my life and my career, even when I've made sort of risky decisions that haven't necessarily seemed logical. But like often when I've trusted my gut for stuff with me, the kids or otherwise, it's paid off.
What makes you authentic and unique?
Oh, yeah, I loved this question. I don't honestly know. I think that I can generally make people feel comfortable, like when they come into clinic. Like I generally just think I create a space that is very safe and open. Nothing phases me, nothing, like you could talk to me about any crazy stuff and I'm not going to be like, oh, I think worse of you. So I don't know if that is massively unique, but I do think that's something that I do bring to the table within my career, my business, and also I think at home as well. So
Yeah.
I'll go with that.
Nice. Do you know what? That even if it's not unique, it's still authentically you. And that's all we care about on the podcast.
True.
It's just authentically. As long as you're authentically you guys, that's
true.
unique. That's unique. So obviously, just to close up, if do you have any finishing sentences, any advice you want to give anyone or any of the audiences, anyone who listens to it? Do you have anything you want to say?
I think just like consider pelvic health for yourself, for your, if you are in health, for your patients, think about the significance it has, and just be really open to working with everyone around you, because I think it makes such a difference. And drop competition and, bring up collaboration, because that honestly is the game changer for you as an individual, but also society that going ahead. So I think that's a
honestly,
really,
that's a really, really, really good point, actually. Do you know, I really like that you said that.
I think that thing is, we all have a responsibility to stand up and say, look, this is available, this is support. And I think the more that we all do that, and that's why I love having opportunities to come and do things like this, where we can just talk openly about it. This is when change happens, slowly and surely. So, thank you for opening that conversation, because within the MSK world, that's still relatively new.